Continuing on now on chapter 4, finishing up our connective tissue as well as muscle and nerve. Connective tissue has a lot of extracellular matrix, and it is composed of what's referred to as ground substance, which is essentially what is making up that extracellular matrix. And there are a few common ones that are found. Hyaluronic acid. This is a polysaccharide, just meaning it's made up of lots of like glucose molecules or little carbohydrates. This is really good as far as lubrication. So one place we find it is in the vitreous humor of the eye. Proteoglycans is another common one. So these, as the name implies, are proteins as well as glycans. So the glucose, glycans, think about carbohydrates. So it's proteins and polysaccharides that come together to make up glycosaminoglycans. And these proteins, though, attach to hyaluronic acid, and what that does is it traps in a lot of water. And then we also have some various adhesive molecules, again, connective tissue connecting to each other, and this is going to hold those proteoglycan aggregates together. So some examples of these: chondronectin in cartilage, osteonectin in bone, and fibronectin in fibrous tissue. Now what these look like, again, these are just that connective tissue matrix. So here's some collagen fibers that are there. We have elastic fibers that, as the name implies, can stretch and then relax. And then here are some of these proteoglycan aggregates like that hyaluronic acid that are there, the proteoglycan monomers. And again, whenever you combine these, it traps the water in here. So especially good in our joints and our knees. All right, now there are various types of connective tissue. So again, our tables here will help us. So we have areolar connective tissue. So this has a fine network of fibers like collagen that's in there. Its function, it is loosely packed, so it provides some support and nourishment. And it's throughout the body that we see this. But again, we have that network of fiber with different spaces in between those fibers. Then adipose tissue. So adipose tissue is one job is really just to package material, so it's to store fat. We do have two different types of fat. So we have yellow adipose. It's actually white at birth and then turns yellow as we age. And then brown adipose that gets its color because it has a lot of cytochromes. And this is found especially in babies and infants. And this fat isn't necessarily for storing nutrients, but for generating heat. So again, babies trying to maintain that tolerable internal condition or condition of temperature, they have a lot of brown adipose in various parts to help insulate as well as provide heat for their organs. So you can see in these just a lot of cells with open spaces, and that's just those droplets of fat that are there. Now this one does have little extracellular matrix compared to the other ones. It's mainly just a bunch of cells storing fat. Now reticular tissue is our next one. We'll switch back to our yellow. So reticular tissue here, this has a fine network of what are called reticular fibers. Now they are irregularly arranged, so they don't have a specific pattern. But it gives this superstructure mainly in our lymph system and then our hemopoietic tissue, those that are generating blood. So we see these in the lymph nodes, the spleen, and the bone marrow. Now we also have dense regular and dense irregular collagenous tissue. And as the name implies, the regular has a repeating pattern, so it is very kind of organized and structured. Whereas the irregular is, again, as we can see here, we have some going one direction. So again, not a lot of patterning that we see like we do with that dense regular. Both of these, as the name implies, though, made up of collagen fibers. But again, these go essentially in the same direction. So we see them in the tendons and ligaments that are there. So pulling forces are helpful, or it helps with those. Whereas the dense irregular, those collagen fibers go kind of in all directions here. It does provide tensile strength, so it can withstand a lot of stretching and pulling. So thinking about like our skin, and some of the organs that can stretch because of this dense, irregular, collagenous connective tissue. In addition, just a little bit more, we have the dense, regular, elastic connective tissue instead of the collagenous, and then the dense, irregular, elastic. So again, both of those, same kind of idea. The dense, regular has a pattern where they're moving in the same direction, whereas irregular, they're just kind of all over the place. Here, again, still some collagen fibers, but also the elastic part comes in because of the elastin fibers that are in there, which makes it elastic. So again, the stretching and recoiling, kind of like a rubber band. So we see this in ligaments. But then also the irregular, again, still collagen and elastic fibers, but just going in lots of different directions. And as we've seen with the collagen, all those different directions provides tensile strength. So it helps with that. So like our arteries, we want them to be stretchy, but also strong. Now, some of the supportive connective tissues that we have, so cartilage, for example, is one. It has those chondrocytes with that extracellular matrix that's called leucinia. So the types of cartilage, though, depends on that matrix. So it has a firm consistency, and again, that ground substance that we just went over is the proteoglycans, as well as the hyaluronic acid that, again, helps trap all that water in, so they can spring back after being compressed. Now this is avascular, so not blood flow coming in, also no nerves coming in. So because it doesn't have blood coming in for nutrients and it doesn't get stimulated by nerves, the healing is really slow in our cartilage. And then we also have the term perichondrium. This is dense, irregular connective tissue. Again, the fibroblasts here differentiate into the chondroblast, and remember, blasts break down the material, so in this case, cartilage. And we have three different types: hyaline cartilage, fibro cartilage, and elastic cartilage. So first here, the hyaline cartilage. So these collagen fibers are small, kind of evenly dispersed, so they almost make it look transparent, where you can kind of see through it. So we have the chondrocytes in spaces, those spaces, again, the leucinia. And again, this is firm but flexible. So it allows for growth of those long bones. Get a little rigidity and some flexibility in the trachea, for example, is where you could see these. Now the fibrocartilage, this has, again, those collagen fibers. They're kind of similar to the hyaline cartilage, but the fibers are much more numerous. So we have a lot more of them, again, not the spaces that we had seen with the hyaline. Again, these fibers are more packed together here so that they look more like thick bundles. So again, still flexible, but can withstand a lot of pressure. So this is important for our intervertebral disc, as well as the articular disc that we have. And then the elastic cartilage, so this, again, similar to the hyaline, but the matrix also, in addition to the collagen, has the elastic fibers that gives it its name, elastic cartilage. So again, we still get the rigidity, but also some flexibility, more so because of those elastic fibers. So places like the external part of the ear or auditory tubes is where you would see this. Now, another supportive connective tissue is our bone. So we may not think about a bone as being a connective tissue, but it very much is. So it has osteocytes, which are going to maintain it, and then it mineralizes the matrix. So that extracellular matrix becomes hardened. Of course, our bones are hard. So again, what's being secreted and into that extracellular matrix becomes mineralized. So that matrix, though, gives it strength and rigidity, helps support the tissues and organs underneath it. So we have organic matrix, which is the collagen, but there's also inorganic matrix, so hydroxyapatites, and this is calcium and phosphate that can be used here. Again, osteocytes located in those leucinia. It does have a rich blood supply, so it's going to have a faster recovery and healing process. And then there are two types of bone: spongy bone and compact. So starting first with that spongy bone, As the name implies, it kind of has a lattice work, so it looks more like a sponge. It's characterized by these tuberculae, and then some large spaces in between. So again, hard to see here on this, but again, kind of a spongy, has a bunch of open holes, not real densely packed. So this provides the scaffolding to provide the strength and support without a lot of weight that's added to the bone. So this is going to be on the interior of the bones, like the skull and the vertebrae, and at the end of the long bones, which is what's shown here. Now the compact bone, sorry, I'm struggling there. That compact bone, unlike the spongy bone, is hard. Again, those bony matrices predominate, so with lots of osteocytes that are there that are located in the leucinia. But again, this happens in a circular fashion, so as we can see here, it kind of looks like a tree trunk whenever we look at it. So it has a central canal here for blood supply to come in. Again, our leucinia here with the osteocytes, but again, we just get these ring structures that form around that central canal. Another connective tissue that we talk about is the blood. So now this one does not have fibers. So there are no collagen fibers or elastic fibers, anything like that. It is completely fluid. The matrix, though, is formed by other tissues, unlike the other types where they're making their own matrix. In the case of blood, that matrix is made by other cells. So it moves through the vessels, of course, but both the fluid and the cells can move in and out. So it's the formed kind of elements here. So we have red blood cells, white blood cells, and then the platelets. So again, our red blood cells, they don't have a nucleus. They kind of look like little donuts. The white blood cells, though, those are going to have a nucleus, at least one. Some of them have more than one. And then the platelets are going to be the little fragments that we see where the blood vessel has ruptured. Now, hematopoietic tissue, this is actually what forms or makes the blood. So this is in our bone marrow. A couple different types of bone marrow. So red bone marrow, that tissue is surrounded by those reticular fibers. That's what makes our red and our white blood cells. But we also have yellow bone marrow, and that yellow is due to adipose tissue, and these are not making any blood cells. So what happens as children grow, the yellow replaces much of the red. All right, so just a nice little summary. I know it's kind of small here, but from the PowerPoint you can see it. Just a summary of all the different types of connective tissues, so being able to recognize these as well as the distinguishing characteristics. Moving on now to our muscle tissue. So of course, characteristics is that it can contract and shorten with force, so it moves the body as well as pumps that blood, one of those connective tissues. So we have three different types. So we have skeletal muscle, cardiac muscle, and smooth. Skeletal, as we could kind of imagine, that's attached to the skeleton. This is going to be voluntary movement, so we are telling these muscles to contract. It has striations in it that we'll see in the next pictures. The cardiac, again, name kind of implies, but it's a muscle only of the heart. It is also striated like skeletal, but it is involuntary. We don't have to think about our heart beating. And then smooth muscle, as the name implies, it is non-striated. It is also involuntary. Here we have usually around tubular structures, and then like our ducts or glands, and then also within the skin. So our skeletal muscle, so again, these striations, the lines here that we see here in the cartoon kind of drawing these red lines here, those are the striations we're referring to. So again, these muscle cells or fibers appear banded. So we have actin and myosin that are in here, and this allows that movement of the body and that controlled, voluntary control and movement. Now the cardiac muscle, again, is also striated, so we get the lines here, but it's more branched than what we see with the skeletal that was just kind of packed on top of each other. The cardiac is more branched, but again, also striated here. But again, the key here are those branching, that branching that occurs. And of course, in the heart, this is used to pump the blood as well but under that involuntary kind of unconscious control. And then finally our smooth muscles. So again, here we have the tissues, but there are no banding patterns. It just appears smooth in there. So they're also tapered at the end of each of those cells. So this helps to regulate the size of the organs. It helps force fluid into tubes, controls actually the amount of light that comes in, and produces those little goosebumps that we get. And again, this is involuntary control. Finally, then our nervous tissue. So nervous tissue, of course, what coordinates in our brain. So it's made up of cells called neurons. Now these can produce electrical signals that we call action potentials. So muscles, again, can contract. Neurons can create electrical signals. They have a cell body where the nucleus is. They have a single axon that's going to actually conduct the impulse, that action potential, away so that it can act on another neuron or a muscle or gland. But then it has lots of dendrites. Those are going to be receiving the impulses for that information that then is communicated through the cell body to the axon. And we have multipolar, bipolar, and pseudo-unipolar neurons that we see based on kind of their branching. Glia is the support cell in the brain, also in the spinal cord and the nerves, that's there to nourish and protect as well as insulate our neurons. So the pseudo-unipolar, again, looks like it has a single pole, but as the name implies, does not. So it consists again of the cell body with an axon. So it conducts those action potentials and is found in the ganglia outside the brain and spinal cord. Now the tissue membranes here that we talk about, and this is for all tissue types, we're not still on the nervous tissue, but all of them. So tissue membranes, we're talking here about a thin sheet of tissue that covers a structure or lines a cavity. So just the tissue membrane. So it has superficial, just on the outside, epithelial tissue, because again, epithelial is always on the outside, and then a connective tissue that's underneath that. So then we have cutaneous, so like the skin. We have mucous membrane, serous, and synovial. So again, we'll cover more about the cutaneous in the next chapter, but going ahead and hitting here on the mucous membrane. So these are going to line cavities that open to the outside, and as the name implies, they secrete mucus. So those are going to have epithelium with goblet cells to make that mucus, again, a basement membrane to allow them to attach, and then a lamella propria, which sometimes can also have some smooth muscle. And we find these again in the openings, so like our respiratory tract, digestive, urinary, and reproductive systems. Now the serous membranes, these are simple squamous epitheliums called mesothelium. Again, that basement membrane, and then a thin layer of loose connective tissue. And these are going to line cavities, but those that don't open to the exterior. So like the pericardial around the heart, the pleural or the peritoneal. So again, these cavities within the body, they're lined with a serous membrane, but again, unlike the mucus, they're not actually exposed to the outside. And then finally, the synovial. So this lines freely movable joints, and it helps to produce the fluid to enrich that hyaluronic acid that we talked about. So again, just where we can see these. So again, the mucous membranes here on the respiratory and digestive tract. The serous is going to be in these cavities, like the pleural cavity or peritoneal cavity, kind of shown here in red, so around the lungs or around the digestive organs. The synovial membranes, so those we're going to find more around in our joints and around those. Now, what happens whenever we get some tissue damage and inflammation? So first of all, the body responds to damage with inflammation. Unfortunately, sometimes the inflammation is the problem. The organism or whatever causes the damage would be okay, but there's so much inflammation, it causes a lot of side effects to it. All right, so first of all, in order for this to happen, we need to mobilize the immune defenses, kind of let the body know that there's damage. This is going to help to destroy the infection. Excuse me. Help to get rid of those foreign materials and damaged cells and initiates repair. So again, tissue damage or this inflammation process is very important. Again, it can go to the extreme, so that's what kind of activates and helps get rid of the infection or to repair tissue. So now what does it actually look like? I'm sure you've all had inflamed or seen inflamed tissue, so it gets very red, it gets warm, there's a lot of swelling and then pain because of that, and typically some disturbed or disrupted function. So where, again, if your ankle's swollen, it doesn't quite work right. And we have some chemical mediators here that help facilitate this inflammatory process. So these are things like histamine. We think about like allergic reactions, kininogens, prostaglandins, and leukotrienes are some examples. And what they do is they stimulate pain receptors and increase blood vessel permeability. So that's going to let the white blood cells, those leukocytes, out of the blood into the tissue so that it can identify the foreign invader or the damage. But that leakiness that occurs to let those white blood cells out also lets water out, and it causes the swelling or edema. So kind of the stages here of the inflammatory process. So here we have a splinter that's going to damage. It also introduces bacteria. So those chemical mediators, again, kind of the signaling molecules. So again, those histamine, the kininogens, prostaglandins, etc. They get released or activated in that tissue. And then some of the blood vessels, though, can rupture and actually lead to the bleeding that occurs. Now, those chemical mediators, whichever ones they may be, they cause those capillaries, again, to dilate, trying to let those white blood cells out. So that's going to cause the skin to become red as more blood is in the area, and because there's heat contained within that, it also warms the skin. Now, the speed of that depends on a few other things. So that speeds the arrival of the white blood cells and other infection fighting or other chemicals. So it helps get them there, kind of the recruiters. Those chemical mediators also, again, increase the permeability, so it's letting that water come in and the white blood cells to get out, so those clotting proteins can diffuse into those spaces to help form that clot. Now, in tissue repair, again, inflammation kind of triggers the process, but then to actually repair the tissue, this is going to substitute those viable cells for dead ones. So just a couple of terms: regeneration. This was when new cells of the same type are made, and so therefore function is restored. Replacement, though, would be whenever a new type of tissue develops. So this would include like a scar that can include some loss of function. And then some of the cells, based on their ability to regenerate, so labial, this is capable of mitosis through life. So things like our skin are constantly reproducing and regenerating, replacing more skin cells. Stable, so in this case, there's no mitosis after growth ends, but it can divide after injury. So the liver is probably one of the best at regeneration. So again, small pieces of the liver can be transplanted and become viable because, again, it can, when stimulated, it can keep going through mitosis. But then we also have permanent. So these, if they're killed, they're replaced by a different cell type. So they can't go through mitosis and make more of themselves. So things like our nervous system, so diseases like Alzheimer's and ALS, when those neurons are lost, there's no way to replace them with other neurons. So if we look at a few different types here, so we have skin repair. So again, example here of tissue repair. We'll come to the next slide, but first of all, we have primary union, and this is the edges of the wounds are closed together. So this is why sometimes, stitches are needed. But the wound fills with blood. It forms a clot using fibrin. Is a fiber. It forms that scab to help with the healing. Again, helps close off the underlying tissues, instigates some or causes some inflammation. That can lead, again, those white blood cells get secreted and ultimately lead to pus as those white blood cells die. We get granulation tissue. So again, this is going to replace the clot because we don't want it to stay there. And this is those connective tissues that have the fibroblasts and collagens. Is replaced by those. And then unfortunately the scar, though, can form from that granulation tissue that's needed to help replace it. But the tissue then turns from red to white as it pushes out those capillaries. Then we have secondary union. This is where the edges of the wound are not closed, so there's a greater chance of infection. So again, sometimes staples or stitches are needed to turn a secondary union into a primary so that there is protection for those underlying tissues. So sometimes the clot, or what happens here is the clot doesn't close the gap. So there can't be a scar because the clot doesn't completely cover it. Now, in this case, there's a greater inflammatory response because, again, it's open to the air. So we get wound contraction occurs, and we get much more scarring as it's trying to heal and contract. A lot more of the scar tissue gets laid down from that granulation tissue. So in kind of this scenario here, so during the first week, the inflammatory process causes that vasodilation. That's going to take the more blood as well as white blood cells there. Again, that permeability increases, so we get some swelling. Fibrin gets released, as well as blood cells. Those go into the wounded tissue, again, due to that increased permeability that lets them out of the blood vessels. The fibrin isolates, it kind of walls off any bacteria or foreign material. Those phagocytic white blood cells that are called neutrophils, they come into the tissue to help fight the infection. They actually go through phagocytosis, which engulfs or ingests the bacteria and breaks it down. Then neutrophils are killed through this process, and it leads to that pus formation. Fibroblasts from that surrounding connective tissue, they migrate into the clot, make collagen and other extracellular matrix components. Capillaries start growing from blood vessels to try to provide oxygen and nutrients to the edge of the wound. It becomes revascularized, so again, replacing the blood vessels that were lost. And then the fibrin in the clot is broken down and removed. Now, by 2 weeks, that clot has been replaced by that granulation tissue. Eventually, that forms that scar at the wound site. So that tissue is really delicate, but again, granular appearing because it has the fibroblasts, collagen, and capillaries. Now, within a month, we have a lot of granulation tissue there that's been converted to scar, and typically the dent's irregular. So then at first, the scar is kind of bright red because there's still lots of blood vessels present, but then later it becomes white as collagen accumulates and those vascular channels are compressed. And here's just the picture showing this. So again, first of all, we're going to get that blood clot to kind of stop the bleeding in there. Again, our epithelial cells are going to grow toward into the wound. The vascular is going, vascular tissue increases permeability, so we get that edema. We get new fibroblasts that are coming there. Those macrophages are causing pus formation as they're breaking down foreign material. And then that granulation tissue comes in. Those fibroblasts, they start proliferating and growing to form that tissue. And then ultimately, connective tissue and scar tissue gets formed. So then how do we repair our skin? So the repair of the secondary union is similar to what we just went over, but just a few differences. Again, the clot may not completely close that, so it takes longer for the epithelial tissue to regenerate and cover it. So again, more inflammation occurs here. There's more risk of infection because it's still open. And there's also more pus as more neutrophils are recruited to that site. We get more granulation tissue, and contraction of the fibroblast causes wound contracture that results from disfiguring scars being formed. So it's advisable, again, to suture a large wound, and that prevents or kind of changes the secondary union into a primary union. All right, so some molecular tissue profiles kind of going now into our cancer. So the most common types of cancer are actually on the epithelial tissue that has that more rapid cell division anyways. So a couple terms: carcinomas. These are cancers of that epithelial tissue. Again, that includes like the lung or the breast. So again, these are the most common. And then we have adenocarcinomas. This comes from glandular epithelium. So remember, epithelium lines tissues as well as forms glands. So if it's in a gland, it's an adenocarcinoma. Any other place, it would be just a carcinoma. And then we also have sarcomas, and these are relatively rare, but this is where the connective or muscular tissue cells develop into cancer. But again, most common are the carcinomas of that epithelial tissue. And then finally, we have the effects on aging. So as we age, our cells divide more slowly. Blood cell synthesis declines as we get older, so we're less oxygenated, less ability to heal. Those collagen fibers become more irregular, so more kind of stronger or tensile and increase. So those tendons and ligaments are less flexible, more fragile. Elastic fibers have been stretched too much, so they're less stretchy. And then our changes to collagen and elastin ultimately causes the arterial walls and our ligaments to be less elastic, less stretchy. Atherosclerosis and reduced blood supply occurs as those blood cell synthesis declines. The wrinkling of the skin as those collagen fibers start changing. And again, increased tendency for bones to break.